ping pong is being organized all over the world to spread awareness about the breast cancer.
First, it started in Mumbai, and then later on, it gradually went on to every registry. Breast cancer is the leading cause, and followed in most cases by cervical cancer.
We call it a lifestyle disease. All the career women, they don't have time to do breastfeeding.
The lifestyle factors of breast and cervix are contra. So, as the breast cancer is increasing, the cervical cancer is actually decreasing, but not to the extent that we can be comfortable about it.
First should be the mammogram, not ultrasound. Why? Because mammogram picks up what we use the word microcalcification. Microcalcification represents earliest cancer, stage 0.
The multiple sexual partners, whether of self or spouse, will increase the risk of infections.
In mammography, the main reason for reluctance is they said, oh, it is very painful. This is an old idea. Actually, in our practice, you'll be surprised that whenever people come and they say, I say, madam, if it pains, I'll not charge you.
The disadvantage of any cancer is it's quiet initially.
All of us are exposed to natural radiation in the atmosphere, which is equivalent to 6 mammography, which is also minuscule. There is so much of hawa about this radiation that, the people are petrified. Oh, no, you should not do it. Please, this message should go that mammography is safe.
And a lot of people have this thing about, if I have a cancer, I don't want to know it. But I say, yes, you do want to know it, and you want to know it early, because early cancer is curable. Late cancer, you can only offer palliation and symptom control, which is a very sad thing for a preventable cancer.
You'll be surprised, in our practice in Delhi, still highly educated women, they come for stage 3 or stage 4.
It is a case of fix your own oxygen mask first, because the woman is the fulcrum, and cancer, when it affects a family member, whether it's a man or a woman, it tosses everything.
If you have a child before 20 years, the chance of breast cancer is 0. If you have the first child before 25 years, chances are very minimum. But if you have a first child after 30 years, then the chances are more.
Hello and welcome to HT's weekly talk show, The Interview, and our special segment, Health with HT. Women's health remains a major issue in India. Even if there is awareness, there is little follow-up action. You have come late, very, very late, is what doctors often tell their patients, and this more so when it comes to cancer. The word in itself sends a chill down one's spine. Almost automatically, a patient starts counting days. Will I live or will I die? How much time do I have? Days, months or years? Or maybe not even that. And worse still, why me? These are common questions that torment every patient who is battling the dreaded disease. But all is not lost. Cancer is curable if detected early. But as things are, women often neglect their health, putting family first. Two major cancers that target women are breast and cervical cancers. These come with a baggage of myths, fears, doubts, and a great deal of confusion. There are questions that need to be answered, and today we will do just that in this program. We have with us two eminent doctors who are well known in their respective fields, Dr. Colonel Chandrasekhar Pant and Dr. Neerja Bhatla. Dr. Pant is the go-to person for breast cancer. A distinguished radiologist, Dr. Pant has pioneered breast imaging in India. He can be credited with making early detection and diagnosis of breast cancer more accessible across India. Dr. Neerja Bhatla has contributed immensely to women's healthcare. She has worked extensively in the field of cervical cancer. Early this year, she was conferred the Padma Shri in recognition of her work. Both Dr. Pant and Dr. Bhatla will educate us, set rest doubts, and clear misconceptions about breast and cervical cancer in this edition of HT's weekly talk show, The Interview, in our special segment, Health with HT. Dr. Pant and Dr. Bhatla here with us today. Welcome to the show, Dr. Chandrasekhar Pant and Dr. Neerja Bhatla, and thank you for being here with us.
Thank you.
Thank you, Kumkum.
Let me start with asking you about the so-called pink month. This being the pink month, Dr. Pant, would you like to give a message, and what message would you like to flag as a radiologist?
The Pink Month is being organized all over the world to spread awareness about the breast cancer. My message on this very important day will be breast cancer is curable if detected early. And why it is important to get this message is that, in India, earlier cervical cancer was the first cancer which used to affect women. Now it is the breast cancer which affects the women in our country. So it's a very scary scene. So I think it is important that we have to spread this awareness among all the women that look, you have to take care of yourself, otherwise it will be a very late in the diagnosis of the breast cancer.
Dr. Bhatla, is it right what Dr. Pant is saying that breast cancer has overtaken cervical cancer, or would you contradict that?
No, it's absolutely correct. And initially it started in a few registries. First it started in Mumbai, and then later on it gradually went on to every registry. Today in almost every registry, which is the cancer registries which are maintained by the Indian Council of Medical Research, almost every registry, breast cancer is the leading cause and followed in most cases by cervical cancer.
Why has that happened?
Now, you see,
difficult question, but
it's not a difficult question. Actually, what is happening that we call it a lifestyle disease. In the urban setting, all the career women, they don't have time to get married. If they get married, they don't have time to children. If they get children, they don't have time to do breastfeeding. The common this thing is that you get your processed food and you get the junk foods. There's hardly any exercise. The alcohol has become very prevalent.
Dr. Bhatla, like breast cancer, Dr. Pant says, is a lifestyle disease. Is that true of cervical cancer also? And does food, junk food, processed food and lifestyle contribute to that, or it has no relationship?
The lifestyle factors of breast and cervix are contra. So as the breast cancer is increasing, the cervical cancer is actually decreasing, but not to the extent that we can be comfortable about it. Breast cancer is more common in those who have fewer pregnancies, who get married late. Getting married and having the first child after the age of 30 are the most important and most avoidable, I would say, in a way, epidemiological factors which have been shown to have impact. In cervix, it is the multiple pregnancies, early age at marriage. Common to that is also smoking. And so these are the factors which are very important cervix. The multiple sexual partners, whether of self or spouse, will increase the risk of infection. The other very interesting about cervical cancer is that it has a very long natural history. It has a pre-cancer phase for 10 to 15 years before cancer develops. And that is where we can target by having routine screenings, by having treatment of the pre-cancers and removing them with simple outpatient procedures and not progressing to the cancer stage at all.
10 to 15 years in cervical cancer. What about breast cancer?
Actually, it's a very difficult question to answer, because normally they say the lean period or the latent period is about between 6 months to 1 year, because there are the various types of breast cancer. There is not one type, they are aggressive cancer, they are non-aggressive cancer. So it differs, the time lag differs a lot,
Is cervical cancer any type? Is it all of it aggressive?
So, I won't say that they are particularly aggressive or otherwise. There are two main types, the most common being the squamous and the other one being the glandular type, the adeno. The adeno is less common in India, but now in countries where they have good screening, they pick up the squamous one easier and the adeno becomes more. But as aggressive goes, no, they're pretty much the same. The disadvantage of any cancer is it's quiet initially. It doesn't cause symptoms until it becomes large enough to cause pressure symptoms, to impact the functioning of the glands around, or the organ itself where it is based, and that's when it really starts to manifest and cause the problem, by which time it's too late. And that's why you need screening to detect the asymptomatic ones. And a lot of people have this thing about, if I have a cancer, I don't want to know it. But I say, yes, you do want to know it, and you want to know it early, because early cancer is curable. Late cancer, you can only offer palliation and symptom control, which is a very sad thing for a preventable cancer.
Like the pink month in breast cancer, in cervical cancer, is there some specific categorization or month like they have in breast cancer, or in cervical there's nothing like that?
No, of course we do. We have January as the Cervical Cancer Awareness Month. And now, because WHO has actually put out a call for elimination of cervical cancer, which is a very ambitious goal. And the aim is to bring it down to the realms of a rare cancer by putting in place 90% of girls to be vaccinated, 70% of women to be screened at 2 time points of 35 and 45 with an HPV test, and 70% of those who have found to have a lesion to be treated, because just finding it doesn't save you. You have to get treated. So making all these linkages and all of that is important. So this was rolled out on the 20th of November in 2020, right in the middle of the pandemic. And that is what has now been decided in the latest World Health Assembly, that it will be celebrated every year, the anniversary of the Global Declaration rollout.
So we are close. October is the pink month for breast cancer and November for cervical cancer.
India also observes 7th November generally as a cancer day.
Take me through the why and how of cervical cancer.
Early stages, pretty much asymptomatic. Some women may come because they have persistent discharge. Some women have postcoital bleeding or postmenopausal bleeding or intermenstrual bleeding, and none of these should be ignored. They are not normal. And in some cases, when the lady is having a checkup for any reason, the doctor sees that it looks like a suspicious lesion and it might be a growth. These are the early symptoms. Late symptoms could be back pain, sciatica, urinary symptoms, rectal symptoms. You don't want to wait till then. The earlier stages, very interestingly, are reversible. So they may be, the body's immune system clears them out considerably. HPV infects 85 to 90% of men and women at some point in their lives, almost like the flu. And like the flu, the body clears it out in almost 90% of them. It's just about 10% who are left with persistent infection, which the body cannot clear. And those are the ones which we have to target to follow up. Just an HPV positive doesn't mean you're necessarily going to get cancer. There's no reason for alarm, only for caution and awareness and watching it regularly.
Among the many issues, is reluctance the main issue, Dr. Bhatla and Dr. Pant, in breast cancer and cervical cancer?
So I think there's generally not a philosophy of prevention. I said that people say, I don't want to know. The other view is, it's not going to happen to me. These things happen to someone else. So there's a general reluctance to appreciate the role of preventive care. But on every metric of cost effectiveness, prevention is the way. And that is why it's important for governments and systems to put this in place and people to do it. And many times it's like, even for our domestic workers, industrial workers, they will lose wages if they go to get a preventive test done. So it has to somewhere come into our ethos or mandated that you have to let people go get the checkups done. But then there have to be services available. So you have to set all that in place. The government does have a program since 2016, and about half the districts are covered by that. But there's a long way to go to have adequate training, quality assurance, linkages, and all of that.
Dr. Pant, in breast cancer, what is it that the government can do and has not done?
I thought I'll take that question of reluctance.
Reluctance.
So basically, as against cervical cancer, in mammography, the main reason for reluctance is they say, oh, it is very painful, we should not do it. Now, this is an old idea. When earlier, about say 30, 40 years back, when they used to have a crude mammography machine, probably the pressure was. Now, today, with all state-of-the-art machines having its sensors, which what we call is the OPCOM device, optimum compression for the least discomfort. Actually, in our practice, you'll be surprised that whenever people come and they say, I say, madam, if it pains, I'll not charge you. The other thing which they are very reluctant is that oh, there's a lot of radiation, we don't want to do it again. There's a huge reluctance on their part. And unfortunately, this message has been conveyed to them through their primary physicians. All of us are exposed to natural radiation in the atmosphere, which is equivalent to 6 mammography, which is also minuscule. There is so much of however about this radiation that the people are petrified. Oh, no, 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 you should not do it. And when is the where did you get this knowledge from? Oh no, our doctor has said so. So I think this message should go that mammography is safe. If you have a backache and you suddenly go, oh, Dr. Samara, do my spine x-rays, which is equivalent to 5 mammogram. The other thing, reluctance is probably, since it is a slightly expensive, so a lot of people feel maybe the ultrasound is a better choice. But when we start as a screening at 40, I feel that first should be the mammogram, not ultrasound. Why? Because mammogram picks up what we use about microcalcification. Microcalcification represents earliest cancer, we call it ductal carcinoma in situ, stage 0. Stage 0, which has the best outcome, is a small surgery, no chemotherapy, and maybe no radiation, large number of cases, has 0 symptom. It is only picked up by mammogram, not picked up by ultrasound, even not picked up by not picked up by MRI. That's why even after 60 years of all these innovations and all that, mammography still remains a gold standard for early detection.
Before we come to the government, Dr. Bhatla had a very interesting quote on pain vis-a-vis breast cancer. I'm going to request you to repeat that for you to contradict or take it.
No, it was indeed many years ago with the old ultrasound, old mammography machines, where one of my patients said they squeeze it and squeeze it till the tears come out of your eyes. But I think exactly as Dr. Pant explained, that's not the case with the modern machines. There is an element of discomfort, but that's about it. I don't think it can categorize as pain.
Yeah.
But tell me, in government hospitals, those old machines still must be existing, or in general hospitals where they squeeze and squeeze till tears come
I
out?
think they're more or less getting replaced. I mean, every machine has a lifespan, whether in government or otherwise. So most of them, I think, have now been replaced by modern machines. Yeah.
So pain is not an issue.
Pain is not the issue. The issue is more about providers also finding time for prevention, because at the end of the day, curative services are what take up everyone's time, and still there are long queues and waiting lists. So finding people who will focus on the preventive when patient doesn't ask them to, that is the challenge. And that is where awareness of the women themselves to go and ask for the service, even if the doctor is busy and not reminding them. It should come both ways, but women have to take charge of their own health.
Is the issue, and I ask this to both of you, awareness, or is it reluctance, even after knowing that we should go once a year for mammography, for instance? Forget about it.
No, I tell you that Kumkum is a very interesting question that you have asked, because the people say that awareness, you'll be surprised in our practice in Delhi, still highly educated women, they come for stage 3 or stage 4. Breast cancer is one cancer which is fully curable.
What about cervical? Is it fully curable?
Yeah, it can be detected before the cancer itself, but even stage 1 has very good survival.
Basically, breast cancer to begin with is painless. And large number of women will come to us, कि, what happened, why you come so late? Say, doctor साहब, pain ही नहीं था, इसलिए हमने सोचा कुछ भी नहीं है. Second, there's a denial. The women don't want to understand that, that we are having something. And then the third reason, which is there is a social taboo. Whenever they want to hide it, because if the society comes to know that this lady is having a breast cancer, her daughter who's marriageable age will also probably have it. The other thing which you also pointed out, and Dr. Bhatla also pointed out, that women keep their health last priority. Women have to give the priority. It reminds me of a very interesting thing from my father. When, earlier days, I don't know how many of the young people will know about the inland letters. He used to write, and it is a golden words which that unless you look after your health, you cannot look after others' health. So I think every woman has to understand they should give priority. If there's anything, they should discuss among whom they want to discuss and seek immediate attention. Otherwise, it will be too late.
Dr. Bhatla, is it what Dr. Pant is saying, or is it like you said, women say, we don't want to know?
I think it's a mix of everything, but what he said is very right. It's a case of fix your own oxygen mask first, because the woman is the fulcrum. And cancer, when it affects a family member, whether it's a man or a woman, it tosses everything. But for cervical cancer, the years of life lost are the most, because it affects women in the prime of life, younger than ovarian cancer, younger than breast cancer. It does really play havoc with the individual, with the family, with the community as a whole, and eventually the nation.
Before we come to my next question, which again I will address to both of you, we were talking about the government role vis-a-vis breast cancer. Dr. Bhatla explained in the cervical cancer. What has the government, what should the government do? Where has it failed?
See, Kumkum, we must applaud the efforts by the government, that National Cancer Control and Prevention Program, which is run by Ministry of Health, is an excellent program. But as far as the breast cancer is concerned, there are two things which are needed to be taken care of. One is the robust awareness program, which is a most important thing. Second, which is most important, is downstaging the stage of breast cancer at the time of presentation. So when I am saying downstaging, so normally one study had come which is that 60% of women in India are diagnosed at the stage 3, whereas 60% of Western women are diagnosed stage 1. Now, there's a huge distinction between stage 3 and stage 1. Stage 1, the survival is 94%. Stage 3, the survival is 47%. So if we can downstage the women at the time of presentation by intervention, that will be the great achievement. And this can be done at the primary health center level, at the district level, at the state level. I would like here to quote a very interesting study which was done by Tata Memorial Hospital, where they did a 20 years, this thing from 1908 to 2018, where they trained the young girls in clinical examination. They screened 1.5 lakh women. They did the awareness as well as clinical examination. They had two groups. One group didn't have a clinical examination, other had a clinical examination. This is the marked this thing of downstaging. Large number of this group presented in stage 2. At the district level, when these people have been identified, that those who have a lump, they have not yet said it is whether benign, whether cancerous or non-cancerous, they come to the district level. And district level, we can add ultrasound. Now, we have a very robust society called Breast Imaging Society of India, which has almost more than 900 members, which have spread all over the country. And most of these are lady radiologists. So, there is no hesitation on the part of women to show it to a male, this thing,
Let me interrupt you there. Is there hesitation for women, even in the urban setup, to come to a male doctor?
I'll give you in my clinic. So, I have my partner, Dr. Vanita. So, whenever they want, they definitely prefer her over me. Earlier, when they didn't have the option, they had no problem. But ever since Dr. Vanita has joined me, they say he will prefer I'm sure Dr.
Yeah, and that's why gynecologists need to take charge, because eventually they are the primary point of contact. Primary doctors need to take charge of this important responsibility.
So, vis-a-vis the government, and I again address this to both of you, what are the loopholes we need to plug?
It's a complex from primary to district to tertiary and then back down again for the follow-ups, which have to continue lifelong. So, or at least for 20 years. So, building those linkages is tough. And I think, as with everything else, public-private partnerships are required. I don't think it is possible for the government to do this task alone. And we've seen great examples of public-private partnerships with Rotary, with other organizations. And I think something similar is required even here, because that's creating those linkages with the secondary services to know where they are, to send appropriately to where they will find a doctor who will attend to them. Because it's very disheartening for the patient also. If she's got herself screened, she doesn't have a problem. You've told her go somewhere for the next step, and she goes there and doesn't find anyone. Or that person is just busy with curative and says, come again another day. It doesn't work. She loses her motivation, because she thinks also it is really not important. Otherwise, the doctor would have done what he had to do. So we need to sort of find a way that we can rope in voluntary organizations to fit this as well.
My impression is that the hurdle of awareness we seem to have crossed, at least in the urban setup. I think women are aware.
No.
No?
It is not.
Because I would go with Dr. Bhatla, who says patients say, we don't want to know. I think that probably is what, to my mind, is the challenge rather than women not knowing. Because I think they all know. But
No, it's also like I don't need it. It's not going to happen to me.
at what age should one start getting tested and for how long?
For cervical cancer, we recommend 30 years onwards. There are many countries in the developed world which say 25, and we don't, simply because it's something which you have to do for the whole population and it should be cost effective. And we don't see cancers usually below the age of 30. That's when they start to rise when we see our charts. So women before that who are symptomatic, it's a different story. Definitely they need to be evaluated. But as applying to the whole population, it starts at 30. And we are recommending a test called VIA in the national program, and most metros were doing the pap smear. Now the HPV test is found to be the most accurate, but there is a rider there that it should be done by the validated tests and not just some homegrown test which may or may not be accurate. So if we can do that with the validated test, then once at 35, once at 45 should be enough.
Breast cancer, how often?
Mostly they say they start at 40, but after that, what should be the interval between 2 mammograms is controversial. US Task Force, they say between 40 and 50 once in 2 years. American Cancer Society say once a year, going up to 74 years. Now Radiological Society of North America, which is the main implementing it, they have said that you can go up to 78 years of age. Now European says they're starting at 45. You do once in 2 years till 75. Breast Imaging Society of India, they say that because there's a difference between the age at incidence of breast cancer in India and abroad. India, it is 10 years younger. So we have breast cancer strikes younger women in India at the mean age is being 50, while the mean age for Western countries is 60. So they say that since it is striking early, so we should start 40 and we should do it annually. So there is a huge controversy which is there. So probably,
So forget they say. What do you say, Dr. Pant? So at what age should we start and when should we?
Kumkum, we have in our practice, we have found that yearly does great job. If the gap is more than 1 year, then probably the cancer if develops between 2 mammograms, it may go to stage 2. But if the gap is 1 year, then it is still stays at stage 1, which we have seen in large number of our cases.
So at what age should one stop?
So I'm saying that that is a very tricky question. So people earlier they used to say that you stop at 75. Now someone says 78. We have people who are 80, 85 coming to us, talks up.
Is there an age bar?
Depends basically on the life expectancy in the country and how long you expect to live and how long you think it will be where you get the cancer and you actually die from it versus you die anyway. So those are the kind of things that are factored in when these kind of decisions are taken, really speaking.
So is there an age bar when it comes to cervical cancer?
So in age, usually it says 65, but depends on the technique you use, because VIA is no use once they are in menopause, so maybe cut off at 50. But if you're using HPV test or PAP, you can go to 65 and HPV can actually go further down. So this is all being discussed now in European countries. In fact, the IARC, WHO, International Agency for Research on Cancer, I'm part of that team which is looking into the guidelines. So because they have long life expectancies, they are arguing for carrying on longer because the women don't want to be caught with this in a later age either. So it all depends on your resources, on the kind of age prevalence you have, on the kind of systems that you have and how much you can afford to put out there.
So in the Indian context, what is applicable?
So in Indian context, presently, it's screening for cervical cancer by VIA in the national program. It's screening for breast by the clinical breast examination, teaching them about breast self-examination, which is also important, and then doing the oral screening as well. So these three are part of our national program. As far as the women are concerned in the urban settings, we do advise them that they should start at 30 and carry on until the age of 60, 65.
Dr. Bhatla, I had one question because a lot of women, they come to us for breast and then suddenly they ask us, it also for how frequently we should do screening for cervical cancer, the pap smear.
Pap smear is recommended every 3 years and HPV testing is recommended every 5 years.
Oh.
But the cutoff is 65 years.
Yes, yes. Provided your reports were all negative till then.
Provided reports were all negative.
Yes, then you stop.
Okay. But if there are people, because all this awareness and all these facilities have come now, but now if there is a segment of women who have not done all this and have crossed 65, what should they do? Should they just say, we have crossed it?
No, you've raised a very important point, because somebody who was actually interviewing me said, oh, I'm over 50. And for the HPV test, the WHO minimum is 35 and 45. I've crossed that. I'm 50. I don't need to be screened. But if you've never been screened, you definitely need to be screened at least once, because you could be harboring already an advanced growth and not know it.
And since you have that 10 to 15 years.
Yes. So you must get at least one screening done before you call it a day, at least.
At any age.
But as such, it says 3 negative screens, but at least one time, even if you're 60, is a good thing to do.
Dr. Pant, you said that breastfeeding provides protection. Just explain this to me.
The hormones produced during the lactation, they suppress the estrogen, and that is why the breast cancer is reduced. The incidence reduces during lactation. They say that ideally the feeding should go for 24 months. That is what the ideal thing. But even in the 12 months when it provides a lot of prevention against breast cancer. Also because your menstruation is stopped, so that you have a low estrogen levels. So till you are having the feeding, the estrogen levels are low. You get prevention. Forget about this. There's another thing which is very important, is that one of the risk factors for breast cancer, which we talk about when we are in the initial when you ask this question, is first childbirth after 30 years. Ideally, if you have a child before 20 years, the chance of breast cancer is 0. If you have the first child before 25 years, chances are very minimum. But if you have a first child after 30 years, then the chances are more. Dr. Bhatla can...
Yeah. Dr. Bhatla, would you add to this?
Yes, I did mention that. In fact, one of the very important things is the timing of the childbirth, which gives a break to the system and which provides a great relief. But I want to say something about the hereditary cancers, and Dr. Pant alluded to the fact that they are worried that they will not be able to find matches for their children, which is the case in some segments of society perhaps. But you want to be healthy and alive before you want to worry about marriage, and there are enough educated people who don't care about it and who are ready to accept. Why? Because we actually have solutions. And if you know that you have a familial cancer, you can actually screen more closely, earlier, with other techniques like MRI and ultrasound for breast, for example, with looking at other things like ovarian cancer, which is a very nasty cancer, which is linked in the familial cancer syndromes. And then there are more which are linked with many other cancers, even in the men. So it's good to know that you have it. There are preventive treatments. There are chemoprophylaxis agents. There are ways of risk reducing surgeries which apply. And there are also lifestyle choices that you can then make, knowing that you have a certain risk. So I think for various reasons, people should not hesitate to get their familial story checked if they have more than one person who has cancer in the family, and especially if that cancer occurred at an early age.
What is the role of vaccination in cervical cancer and the after effects?
I think vaccination is the only real game changer, because we've talked again and again about the difficulties of implementing screening programs. We've talked about the problems in linkages, about follow-ups, and we all know how well the message of vaccination goes out in this country and how rapidly we can cover. We have seen also in COVID. So we have a very good system. It goes right down to the last mile facilities, and we have cold chains, we have the vaccinators, we have everything there, and people trust vaccines here. So this is something which we should exploit, because the vaccines have been shown to be extremely effective. They will cut down our risk by 85 to 90%, even the first generation of vaccines. So all it requires is that we should vaccinate girls under the age of 15 with a single dose of vaccine. Our own trials from India have shown that just one dose is enough. And I think that is going to be the way to go. And that is the WHO target. 90% of girls under the age of 15 should have received the vaccine.
Is there vaccine hesitancy? And what are the after effects of this vaccine?
Vaccine hesitancy is a problem always, but the longer the vaccines have been around, the better the people accept it. And the other problem is that though this vaccine is good for girls and boys, but because of cost implications, we are pushing it as a girls-only vaccine, which it is not really speaking. It's licensed for both girls and boys, and there will be benefits to boys also because aside of cervical cancer, there are other cancers which are caused by this virus. So they will have a direct benefit as well. There will be herd immunity and so many things. So if we push it as an only girls vaccine, then there all kinds of rumors start surfacing that it's going to affect their fertility, it's going to affect their ovarian sufficiency and so on, which is not the case. There's ample evidence that it is a perfectly safe vaccine. And it has side effects as do all vaccines, and they are usually mild pain, fever and stuff like that. There is nothing which has been shown to be more common in vaccinated populations compared to unvaccinated populations, and there are large populations which have been studied in the trials and post trials.
How expensive is this vaccine?
So the vaccine costs really depend on who's asking for it and how, because if you're ordering
What does
it in
that
bulk,
mean?
no, if states order it in bulk, it's a different price. If Rotary, for example, decides that they are going to do a bulk program across their clubs, it's a different price. And if you choose the vaccine which has 4 versus 9 types, it's a different price. So it's all very variable. But I think when you compare it to the cost of the treatment of cancer, it is quite negligible for everybody, I will say. And I will say it's like a life insurance. You never worry that you paid the life insurance money at the premium and you never took advantage of it. You're always happy that you didn't take advantage of it. So let's apply the same logic to the HPV vaccine as well and be happy that you never developed it rather than saying, oh, I don't know if I ever needed it.
Okay. But you've still not answered that for an average patient, how expensive
So
is
as
a
I
vaccine?
said, these vaccines are all variable prices. They change from day to day. But usually
But how much would one have to pay for this to get this vaccine? An average patient who walks into your
So
clinic.
I think presently the costs are around 2,000 to 3,000 a dose, but that is in the market. Like I said, that's not how it's
And
going
how
to
many
be when it
doses
comes.
would one need?
One dose is sufficient till the age of 20 years. After that, it's 2 doses.
All right, which means that till 20 there is one dose. So in a lifespan there are basically 3 doses.
No, just one.
Just one.
Just one if you took it at 20. There's no booster.
All right. Now if you miss that mark.
Then you take 2.
From
21 till 45.
You take 2.
Take 2.
And
that's
if you
it.
miss that also?
No, then just screening.
So which means it's really basically you're paying for 3 doses at best.
No, 3 doses is only for HIV people. It's only 2 at most.
Okay. All right. So it is affordable.
Very much so.
In a sense. What are the top of the mind questions and patient concerns that you're often confronted with?
So I think one thing that patients should understand is that if you detect this early, you can even preserve fertility. One concern is that they will lose their fertility, but if detected in stage 1, it's possible to do even radical surgery, retaining the uterus and allowing the prospect of future pregnancy. So really speaking, concerns about screening and vaccination, I mean, there may be any kinds of questions, but the answer is just that the benefits are more than the risks.
What kind of questions do they come up with?
Not really. It's mostly these about side effects, about risk of fertility being impacted, but the menstrual cycle will be affected. The usual questions, nothing very significant.
Dr. Pant, are you confronted with difficult questions like, Doctor, how much time do I have? Will I live or will I die?
Kumkum is a very, very pertinent question, and actually, this C word rattles everyone. The first impression which goes in every woman's mind, oh, probably this is a death sentence. The second thing which worries them, what will happen to my children? These are the 2 things which actually immediately impacts them. So we tell them, look, it is a screen detected cancer, it's a stage 1 cancer. As I said before, the survival in stage 1 is 94%. But you may say whatever you want to this thing, but it really bothers them that doctor is trying to fool us and he's not telling her.
Not telling the truth.
Is not telling the truth. Kumkum, the biggest problem is Mr. Google. They read what stage 4 does while we are talking to them in what stage 1. The minute you start Google, then you are taken for a ride. So because
there's flood of misinformation.
Absolutely, because I'm not saying that Google is giving a misinformation. It is they are trying to retrieve information which is not pertinent to them.
That
It's not applicable to them.
Dr. Bhatla, like Dr. Pant said, women feel it's a death sentence. Do you confront things like that?
No, definitely that's a concern. And I told you that the patients who have cervical cancer are usually younger women. But a lot of the ones who come in advanced stages are usually women who are older, who don't have access, and who have a very fatalistic approach, which is also very sad, which is why they don't even report initially that they have a problem. We've had patients where the daughter-in-law noticed the stain on the sari. We've had patients where the foul odor emanating because of a fistula got the family to bring her. So those things luckily are getting fewer now, and people are ready to talk about it, because cervical cancer at the end of the day carries a lot more stigma than breast cancer. Because
why is that? And what does that mean?
Anything related to genital, nobody wants to talk about it. So they don't want to say. Breast cancer survivor will proudly say, I'm a survivor, but you have to not see many cervical cancer survivors who will speak out. So that is why it kind of remains under wraps, and we have to bring the conversations into the open. We have to let people be comfortable with the diagnosis, to realize that there is no issue of shame or neglect on their parts or something they did wrong. It's not that they...
Just explain the stigma bit to me.
Anything related to the genital tract, people don't want to talk about it. And other people, if they are told that they have a cervical cancer, genital related issue, they perceive it to be something dirty, something not right.
Is there a stigma to breast cancer?
Well, only thing is stigma what I was talking about, which was that, if the people come to know that, they'll put it as a familiar this thing, and then
my daughter may not get married.
So that is a major this thing. There's a very interesting story. I remember there was a woman, and she was diagnosed by us. She pleaded with us, don't ask for a removal of this thing, because my husband will not like it. But they're so...
Removal of the breast.
Yes. So they were saying that please treat us, and she had come with a stage 3 disease, and she was trying to say that, look, this is not accepted by my husband. So there's a major issue of their having their partner acceptance with a distorted breast or single breast,
I want to let people know that now, especially in the affording groups, there is a feasibility to do reconstruction, and there is a feasibility that cosmetically there will be a good result.
Yeah. Is there a husband fear or non-acceptance vis-a-vis cervical cancer?
So definitely it does impact, because there are people who are, they have had all these surgeries, treatments, radiation. Then they do have issues later with maintaining intimacy and all those things. So I'm sure it does affect relationships. I don't think we've studied it enough, but it goes without saying that it will have an impact.
Before I thank both of you, one last word from you, Dr. Bhatla and Dr. Pant.
I would just say choose prevention over treatment. Go early, go regularly, and don't be afraid. Find the right doctor and get your questions answered from there. Don't fall into the Google traps.
I'm not going to let you repeat what she has said. So please.
I think, Konkom, it is very important for women to understand. It is one cancer which is curable if detected early. The women should not be afraid of going for regular checkups. And once they are detected, the treatment is available, and the best treatment is available in this country. So they have no fear that, and then again, as Dr. Bhatla said, that, early breast cancer, you don't have to remove breast. There's a small surgery, the breast is conserved. Even if there's a stage 2 cancer where they feel that the breast is too removed, now we have a oncoplasty, which is part of any breast surgeon who does it. They have a plastic surgeon who are operating side by side, So that reconstruction is not a major disease. So I think women should be coming forward to saying that, for a regular checkup, especially now that it is a disease of a metropolis, all the women who are 40 plus must start their screening at 40, most of the time when they come, they say, oh, doctor, kuch nikal gaya to kya hoga? Kuch nahi hoga. Because nikal bhi gaya to it is very early. So the women should understand that this is one cancer which is fully curable. They should start their screening at 40, and they should be very regular. At least there's a family history. They must do it every year. If there's no family history, they can choose to 2 years. But in our practice, we do once a year.
Dr. Chandrasekhar Pant, Dr. Neerja Bhatla, I can't thank you enough for your time and for educating all of us about cervical cancer and breast cancer and talking about women's health in general.
Thank you,
Thank
Kokum, for
you.
having us here. Thank you so much.
Thank you.